Hello everyone. Today is Breast Reconstruction Awareness Day, otherwise known as BRA Day, and we're here today with Ruth Harcourt, who is the lead breast reconstruction nurse at the Norfolk Norwich University Hospital, and she's also one of the founders of the breast cancer reconstruction charity Keeping Abreast. So thanks for joining us, Ruth. And we've just got a few questions to ask you about the charity. So if you could tell us, first of all, where and when Keeping Abreast was founded and who founded it, and why you felt that there was a need for the charity's services in the first place.
Thank you, Carolyn. Yes, it's a pleasure to join you on BRA Day. I've been the breast reconstruction nurse at the Norfolk Norwich Hospital since 2003, and I was the first breast reconstruction nurse at the Norfolk Norwich Hospital. We'd never had one before, but because breast reconstruction was becoming much more on the radar, we were offering more and more women both delayed and immediate reconstruction. There was a need for a nurse, and right from the word go, I realised that patients really are the best people to tell other patients about what they've gone through. I know all the technical side of it. I've learnt lots of things as I've gone along, but what I haven't been through is breast reconstruction myself. And I used to have a small cohort of patients that I could call upon who could speak to other patients on the telephone. But it wasn't until 2007 when I was approached by Anna and Beverly, who'd both been through breast reconstruction themselves. They'd found each other on the internet trying to look for some support through breast reconstruction. And they came along and said, is there any way that we can have a meeting of like-minded women? There is an awful lot of support for you out there if you have breast cancer, and so there should be, but there wasn't any specific support for women undergoing breast reconstruction. So this was a great idea, and it was the answer to everything that I'd been looking for over the previous 4 years. They did all the groundbreaking stuff. They approached Macmillan for funding. They had meetings with Macmillan and a few other patients. Macmillan said, invite about 35 people along. You'll probably only get about not even half of those, really. So I found a room in the hospital that I thought could accommodate about 20 people, and we got some teas and coffees on the go. I wrote to 35 patients, and all of those 35 patients came along, and they brought friends with them as well. So we realised that there was a great need for breast reconstruction because of that.
And so, obviously, in normal times when there are support group meetings, how does Keeping Abreast support those ladies who are facing or considering breast reconstruction?
Okay, so Keeping Abreast is not just about supporting you psychologically, although that is a big part of it. We like to educate, because I find that the more information you have as a patient, you will be able to cope with whatever's thrown at you. Breast reconstruction is a big operation, much bigger than having a mastectomy. You will recover quite quickly physically from a mastectomy, but breast reconstruction itself is much harder on the body. There's much more to go through, and if you know exactly what you're letting yourself in for, then you can go through that quite well. So during normal times, I don't think we'll ever know what normal is again, but during normal times, we would have a support group meeting, say every other month in the hospital. We would invite along a speaker, and that speaker would be somebody professional. It could be a surgeon, it could be somebody talking about lymphedema, and so, it could be myself or my colleague who does breast reconstruction as well. And we could give us a short talk, about a half an hour or so. We can fill the auditorium in the lecture theatre in the hospital. And then after that, what we would do is break out into small groups. And some people who were contemplating reconstruction would go into a room with other women who'd already had their reconstruction, and they would be able to physically see what those women had done. They could see the scars, they could see the types of reconstruction, what it did to your body, and of course everybody's different, so we liked to make sure that there was somebody there for everybody.
That all sounds really positive and really worthwhile. Obviously, the support group meetings can't take place at the minute, but there are still plenty of things that the charity can do and those volunteers can do to help the ladies thinking about or facing breast reconstruction or going through the process. Obviously, also after the process, because there's still other things that carry on with the body and so on afterwards that they might want help with or support with. So, can you tell us other ways, now that we can't meet face to face just at the moment, how else the charity is helping?
Yes, of course. So the women who come to the Norfolk Norwich Hospital, all of our surgeons are very pro keeping abreast. They've all supported us from the word go, or as they've come along, they've learnt about keeping abreast and are very, very pro keeping abreast. And we always signpost patients coming for breast reconstruction to, first of all, there's the Keeping Abreast website, extremely useful, lots of information on there, ways of getting in touch with people in your local area, and just by emailing the team who run Keeping Abreast at the moment, then we can get you in touch with other people. Also, your reconstruction nurses or your breast care nurses can approach Keeping Abreast to introduce what we thought of recently was a buddy system. So if a patient comes to me, for instance, who is a lady mid-50s, say, who has had a screening diagnosis of breast cancer and is going to have a particular type of operation like the DIEP, then I can get Keeping Abreast to find somebody with similar circumstances, similar type of operation, and put her in touch with that person. And then they can either get together over the telephone or via email, and it's up to them from then on how they talk about their breast reconstruction. But all of our volunteers have had is a basic training, how to talk to others, and also they are very eloquent about what they've been through, and they know all the nitty-gritty, all the pitfalls, all the pros as well, because there is a lot of good things that come out of reconstruction, and Keeping Abreast have made lots of friends through Keeping Abreast.
Yeah, that's right. And also, we have so many testimonials where people say that the breast reconstruction has actually helped them so much emotionally and also physically to feel feminine again. As you said, you mentioned the website. People might be watching this on the website, but if they're not, they may be watching it on YouTube. And the website is www.keepingabreast.org.uk. And we've got testimonials on there, we've got patient stories on there, we've got recordings of Zoom speaker sessions where we've been having the speakers online virtually because we can't meet face to face at the minute. We've got audio files where people have been on the radio and talked about their experience. So it's worth coming back to the website because there's always something new on there. But you clearly feel that the charity is providing a valuable service, and I just wondered about Standout Moments, because the charity's now been going for sort of 13 years or so, and what has been a standout moment or highlights for you since the charity began?
I have many standout moments. My absolute favourite fundraiser, unfortunately it couldn't go ahead this year, was the fashion show, because I feel that patients the women who become the models, who've all been through breast reconstruction, it's not only what the audience gets out of it, but it's also what they get out of it. And it's an absolute feel-good entertainment of the year, really. And I'm sure that you can find some of the moments on YouTube and via the website as well. Or we've had exhibitions, we've had fundraisers, we've had people run for us in the marathon, we've had people run in the Norwich 10K. We're always looking of new innovative ways of raising money, because the charity is self-funding. We don't get any help from anywhere else. We try and source money where we can. And we've done exhibitions where women who have posed for with their breast reconstructions in a very artistic and intimate way by a professional photographer. If you ever get a chance to see that exhibition, it is very thought-provoking and extremely moving. We're very well supported by local communities. the media support us, as I say, the surgeons support us. So keeping abreast for me is all about feeling good about your body, being able to restore some of that femininity you may have think that you've lost, but not only for women, but for their families as well. So we get husbands, partners involved, families involved. We've had carol concerts where children of families have done readings and got involved. So there are numerous ways that we try and involve everybody in the whole process of breast reconstruction.
Yeah, there's certainly some feel-good social events. I mean, the fashion show is fantastic, and we normally get about 500 people in the audience, and over 2 nights, that's 1,000 people in that week. And it's not just the person who's going through the breast cancer, is it? The breast reconstruction, but it's all the people around them that we're also here to support. And like you say, in lots of different ways, a lot of very fun ways. Like you said, we had a virtual 4 runners in the virtual London Marathon only just a couple of weeks ago. We've got a flock of pink flamingos going from business to business in Norwich at the minute, raising money for the charity. So lots of things going on. And when you mentioned the exhibition, so that's the Keeping Abreast Portrait exhibition. Obviously, at the minute, we can't put that on show either. But next year, we've got plans to do that again, and also to have the fashion show again, and to start again with all the different things we can do. In the meantime, we're really thankful for all the creative ways that people have continued to support us during the pandemic. I just wondered if there's anything else you particularly wanted to add, Ruth?
What I would like to say is, don't be afraid to look at all these things that are going on. Don't hide yourself away. Do check your breasts. Do alert your family, your GP, if you do find anything that you're unsure about. But also not to be afraid of it. We're here to help you, and Keeping Abreast can also give you support throughout the whole way that you're going through.
That's probably worth mentioning as well, obviously, because of the COVID pandemic and the fact that operations were cancelled. There's much more of a waiting time now for people to have their breast reconstruction in lots of cases if it's not immediate, and so people might have to wait for longer. So even more reason for them to get in touch and maybe have a buddy or somebody supporting them along the way.
Yes, absolutely. Yes.
Brilliant. Okay, well, thank you very much, Ruth, for joining us on Bra Day. And as Ruth said, please get in touch if we can help support you. So our number is 01603 819 113. We're on info@keepingabreast.org.uk, and the website again is keepingabreast.org.uk. Thanks very much, Ruth. Thanks for joining us.
Thank you. Thank you.